Msr Heart Center is an advanced cardiac care center situated at Msr Memorial Hospital in the heart of Bengaluru. The center specializes in treating cardiac emergencies, rhythm disturbances of the heart failure management, as well as major cardiac surgeries including heart transplants. In a very short span of time, the center has built a reputation for excellent cardiac care. It routinely receives critically ill patients from across the state and has performed an impressive 14 heart transplants in just a little over a year. The team at Msr Heart Center consists of highly skilled doctors and surgeons with extensive experience in treating both pediatric and adult cardiac cases. Along with a team of dedicated medical and technical staff, they represent Narayana Health's dedication to providing comprehensive cardiac care to all.
We take care of even heart rhythm problems, patients who come with heartbeat issues, palpitations, sudden collapse and sudden death, who get revived. We are able to treat them effectively because we have what is called as a cardiac electrophysiology lab with 3D facilities. We map the heartbeat problems in these kind of hearts, and then we take care of those abnormal beats effectively, eliminating them and curing them of this disease. Apart from implanting pacemakers and defibrillators, which is also required for preventing sudden cardiac death, we also do heart failure implants, what we call as a CRT or a cardiac resynchronization therapy, which helps in reviving weak hearts and bringing them back to normalcy.
Msr Nhc Heart Center has developed a very focused heart failure and transplant program. So far, we have done the highest number of transplants in the state with best results, which is comparable to any other advanced centers. A part of this program, we are running heart failure clinic. This heart failure clinic is a very focused clinic where all patients who are admitted with heart failure are seen in this place. In this clinic, we focus on evaluation of patients and also therapy which is required for this disease, which include heart failure home care. It is first time in the country where patients are trying to take care of themselves, and also they are monitored even when they are at home.
Msr Nhc has been working on a 360-degree cardiac care program, which starts off from providing the pre-diagnostics, holistic cardiac care or prevention of cardiac diseases in the common population, addressing the common cardiac needs of the population, and maintaining highest quality of clinical parameters like the door to balloon, which is one of the best in the industry as of today. We maintain almost like 50 to 60 minutes or probably lesser than that when it comes to a parameter called as door to balloon. So within 40 to 50 minutes of the patient arriving to the center, the patient is taken and treated with a angioplasty or with an angiogram or other needs that the patient requires. Apart from this, Msr Nhc has also been working on preventive cardiology program and extensive cardiac rehabilitation program and a specific heart failure management program, apart from the highest component of the heart transplants. And hence, Msr Nhc has been known as of today as a center of excellence in cardiology and cardiac surgery, and it is an advanced center for cardiac care as of today. So we take pride in having a unit like this from Narayana and establishing an comprehensive cardiac center in Bangalore North. And it has been our opportunity to work with Ramaya group of hospitals or institutions who have provided us this opportunity of establishing this advanced center.
Today, Msr Nhc has turned out to be one of the best cardiac centers, not only in Bangalore but in the country. Msr Nhc does all type of cardiac surgery from neonates to adults. Now we have also specialized in heart failure program, that is cardiac transplant and artificial heart. We have done the highest number of heart transplants in Karnataka, and we have even implanted artificial heart, that is the BiVAD, we call it BiVAD. That is one of the first time in Bangalore. We are capable of putting permanent artificial hearts, and we are doing most of our surgeries minimally invasive, that is with small incisions, be it valve surgery or bypass surgery, and we are doing all complex congenital heart surgery.
This center was established in 2007 under the able leadership of Padma Bhushan Dr. Devi Prasad Shetty. Under his dynamic leadership, we have established this center since 2007 to 2008, almost 10 years. It is one of the most prominent cardiac center in the Karnataka as well as in the country.
The main purpose of starting this center was to enable the patients around North Bangalore to gain access to quality health care in cardiology and cardiac surgery services. Initially, we started doing some simple procedures and simple surgeries like ASD repairs and valve replacements and on-pump coronary artery bypass graft surgeries. Slowly, as we gained experience, we moved on to more challenging surgeries like off-pump coronary artery bypass graft surgeries, valve repairs, and complex congenital surgeries, and even complex thoracic surgeries. Over the past couple of years, we have even started doing heart transplants and ECMOs. We have our own heart failure clinic wherein we actually admit patients with advanced heart failure who are not manageable by routine methods. We admit them in the hospital, we take care of them, we prepare them for transplant, and then we make sure the transplant goes on smoothly, and then we discharge them. And even post-transplant care also we provide them.
Heart Center, we do adult and pediatric cardiac surgeries, ranging from simple to complex surgeries. We also do minimally invasive surgeries, which involves smaller incision like valve replacement and CABGs. Personally, I am proud to be a part of the first cardiac heart transplant, which was conducted in Msr Nhc Heart Center in December 2015. Since then, we have done around 14 cardiac transplants, which involves patients from our state and the neighboring states also.
We have a very active pediatric cardiology and cardiac surgery program, and we do all the interventions for ASD device closure, PDA device closure, and VSD device closure. This is also called pinhole surgery, and we use special springs or devices to close the holes in the heart without open heart surgery. And these children will be fine by the next day and can be discharged within 3 days. We also have a very active color Doppler echo program, and we can screen the patients for congenital heart defects, and they can either be treated medically, surgically, or with intervention.